Okay, so I've been assigned this week to discuss polycystic kidney disease in my discussion posts. So I made a little PowerPoint and I'm just gonna guide you through it here. So, what is it? Polycystic kidney disease is a genetic disorder involving the growth of cysts on the kidneys, which can replace the mass of the kidney and eventually lead to renal failure. I've included a diagram in the right hand bottom corner, which kind of gives you a little visual as to the disease progression. It starts with a normal kidney and then ends with the last progression there, which is a volume up to 20 liters. The cysts enlarge the kidneys, which leads to the thickening, and it can ultimately result in the compression and replacement of functioning tissue in the kidneys. So there's two main causes for PKD, polycystic kidney disease. And the first is autosomal dominant or recessive, which basically just means it's passed down genetically one way or another. And 90% of all cases are autosomal dominant. But the disease can also be acquired otherwise through means such as dialysis. And more than one half of patients who receive dialysis for more than 3 years are diagnosed with PKD. And then here's just a list of some of the resulting comorbidities that are caused by this disease. Things can happen like rupture of cysts, liver failure. You can have aneurysms. Mitral valve prolapse is on here. Renal calculi, renal failure, respiratory failure, heart failure. And the big one is life-threatening retroperitoneal bleeding. Some signs and symptoms. We've got hypertension, microscopic or gross hematuria or blood in the urine. We've got increased abdominal girth due to the swelling of the kidneys due to the cysts. Signs of enlarging kidney mass, grossly enlarged kidneys in the advanced stages, uremic fetor, and pallor. The usual age of onset for autosomal is typically ranges from age 20 to 40. Diagnostic testing used, we have family history is usually discussed related to kidney disease, as most of the cases are passed down genetically. And then they also do a renal ultrasound to get a visual image of the actual kidney so they can see what's really going on. A urinalysis may show blood in the urine, bacteria in the urine, or protein in the urine. Creatinine clearance test results may also show renal insufficiency or failure. Hematocrit may be elevated, and albumin levels may be decreased. And your electrolyte levels may reveal low sodium, high potassium, or high phosphatemia. Treatment for PKD. So we're going to monitor the kidney function. Patients will usually require dialysis or some kind of renal replacement therapy. Transcutaneous electrical nerve stimulation. Low sodium diet, and the fluid is going to be based on the degree of dysfunction. Activity as tolerated in the early stages, and they want you to avoid any contact sports with the advanced disease and maintain moderate exercise to manage hypertensive symptoms. And then finally, we have a kidney transplantation or drainage. And of course, medications. And I've got just on the bottom some examples of low sodium foods. And these are medications used for PKD, which include analgesics, antibiotics, antihypertensives, including ACE inhibitors, diuretics, and electrolyte replacements. These are some of the ATI nursing diagnoses associated with PKD. They include acute pain, chronic pain, deficient fluid volume, fatigue, impaired urinary elimination, ineffective coping, risk for ineffective renal perfusion, risk for infection, and risk for injury. Now I just have some practice questions. So the nurse is giving the client with polycystic disease instructions for replacing the elements that are lost in the urine as a result of impaired kidney function. The nurse instructs the client to increase the intake of which of the following in the diet? The answer is A, sodium and water. This is because clients with PKD waste sodium rather than retain it, therefore requiring an increase in sodium and water in the diet. One more. Which of the following nursing interventions is appropriate in providing care for an adult patient with newly diagnosed early onset polycystic kidney disease? Genetic counseling is the answer. PKD is one of the most common genetic diseases. Thanks for watching.